This is Focus on Your Health on the KJAZ Radio Network. It's brought to you by the good folks at Kingman Regional Medical Center in historic Kingman, Arizona. I'm T.G. LaFredo, and this week my guest is Dr. Jacob Oldham. He's an orthopedic surgeon at Kingman Orthopedics. Hey, Dr. Oldham, welcome.
Thank you. It's nice to be here.
It's great to have you. There's been a boom in the orthopedic surgeon business here lately.
Well, yeah, Dr. Cornelson and I came in to join with Dr. Allen, and we really want to create a team that can handle all the needs of the community.
Yeah. I just did an interview recently with Dr. Cornelson, and now you're here also in your brand new office, and you just still have some packing dust here.
Yeah.
So I'm wondering, my first thought was, well, these two new guys come in at the same time. You got to have a rivalry, right? Isn't this will be the beginning of a rivalry between the two of you?
Well, I certainly hope not a rivalry. My hope is that it's more of a collegial partnership.
A little friendly competition, though?
There may be some competition down the road. I think right now we're both trying to feel like getting our feet on the ground, getting running on our own.
So not a full-fledged orthopedic surgeon smackdown.
Yeah, that's right. We try to avoid that. We try to avoid causing the kind of injuries we like to fix.
Yeah. You have an interesting resume. Where'd you come from?
Well, I grew up in northern Utah, and then joined the Air Force, went to the Air Force Academy straight out of high school.
Okay, so just a kid.
Went to college there and did 4 years of education there. In the middle of that, I spent 2 years in Japan as a missionary.
Wow.
For my church, and then finished up my education, went to medical school. Then that was in Minnesota.
Okay.
And then went from the far north to the far south and spent 5 years in San Antonio doing my residency at the Air Force Base down there. And then we spent time both in Albuquerque area and then in Las Vegas most recently,
right,
working for the Air Force as an orthopedic surgeon.
That's Nellis out there in
That's
Las
correct.
Vegas. And
That's
you were
right.
How long were you there for?
I was there for 6 years.
Okay. And in the meantime, you also spent some time in the Middle East.
That's right. I had 2 deployments overseas, each for a little bit over 6 months. The first one was in Iraq, and the second one was in Qatar.
And what years are we talking?
So my Iraq deployment was in 2009, and then my deployment to Qatar was in 2012.
What was going on where you were stationed?
For my first deployment, basically our U.S. forces in Iraq situation, we were kind of winding things down.
Okay.
We had stabilized, at least from the initial onslaught of putting our people on the ground, and there wasn't as much going on there when I was, over the period of time that I was there.
Okay.
But from a medical standpoint, we were taking care of people who were injured with roadside bombs for the most part.
Yeah.
And then some other odd injuries here and there. Somebody, breaks something while they're working on base, falling off a ladder,
Okay.
things like that. But for the most part, we were there to take care of the service members that were injured, mostly by roadside bombs.
So was it essentially all trauma? Did you ever have any scheduled procedures?
There were some. You'd be surprised. You get a whole bunch of Army guys over there. There's a lot of adrenaline.
Yeah.
What do they do with their off time?
Oh,
they
boy.
play basketball. They lift weights.
Right.
They injure themselves.
Okay.
And so sometimes we would take care of those type of injuries as well, so that we could keep the guys out there deployed to the field rather than sending them back to the States. But mostly we were doing trauma.
Right. Now I wonder, that background in trauma, and probably you saw some pretty gruesome scenes in trying to help people out.
We did.
Yeah. I wonder how that will inform. So you're back in civilian life, and here your procedures will be probably all scheduled, right?
We take care of trauma call. And so,
you do, yeah.
Somebody gets injured on the freeway and they come
Okay.
in and we take care of them, not really on an elective basis. That's
Right.
more a trauma basis. But I certainly hope I don't have to take care of the kinds of injuries that we took care of over in the Middle East. But if you look at the history of warfare and medicine, our medical understanding of how to treat certain injuries that come with trauma always grows leaps and bounds during a wartime, just because you see so much of it.
Yeah. It's one of the positives, I guess you could say, that grows out of.
Yeah, one of the few things that
Right.
we can benefit from in our civilian practice.
Are you able to articulate some of the ways that trauma background informs the work you do now?
I think that really having an understanding and a comfort level with basically whatever comes through the door.
Right.
First off, it kind of helps you wrap your mind around, what do I need to do? What are my primary objectives in this situation, and how do I get there? Because, when you're deployed and you've got soldiers coming in, you don't have time necessarily to sit down and read a book and study up on things. You have to be comfortable with uncertainty.
Yeah, and you're constantly practicing, I imagine.
Exactly.
Right.
Exactly. And then, secondarily, just having a comfort level with the anatomy and knowing that basically you can kind of get around whatever comes in. You can handle it to the extent you may not be an expert in that subject matter, but you can handle it and take care of what needs to be taken care of safely.
Right. When you were in those surgery situations, did you have a fairly good team around you could rely on, or were there a lot of times where you were the guy, you had to get going and fix things up?
Fortunately, I was surrounded by really good people.
Yeah.
Though in both of my situations, my deployments, I didn't have a whole lot of other orthopedic surgeons around me. In my first, I was the only orthopedic surgeon on the base. In my second, there were two of us. And so I didn't have other orthopedic surgeons to discuss cases with and to have them come in, scrub in, and help me with complicated cases most of the time. But just being surrounded by good OR crew, people that knew how to handle trauma, how to take care of patients and help them get better. It's a great blessing to be surrounded by good people.
Yeah. And you get to the point of proficiency. I guess part of it, you never want to reach the state of hubris where you feel like anything that comes in, I got it, it's cool.
Yeah, absolutely.
But at the same point, you need this level of confidence where you think, I know how the human body works when it should work. I know how it seems when it's busted up, and I can do this. I'm cool with this. I can do it.
Rather than feeling like a deer caught in the headlights.
Oh boy, yeah.
You just, sometimes you just kind of try to apply the lessons you've learned from the last case and move forward with that.
Where in this world were you when you performed your first surgery?
That would have been in medical school, I suppose. I mean, to perform a surgery you don't really do it as a student.
Okay, right.
But the first time where I was able to really get my hands on the instruments and be part of the surgery, where I was cutting and sewing and doing, to me, the cool parts of orthopedics, that was in medical school at the Mayo Clinic.
Yeah.
That's a cast saw in the background.
Is that right?
Yeah.
Is that going to go for a while?
It'll probably go for a minute or two at least to get the cast off.
Wow.
Yeah,
I should run out there with a microphone. I mean, if it's going to make an appearance in the show, we should just really. Mm-hmm. Okay, let's pause for just a minute while we get that. All right, I think the cast saw is done now.
Yeah.
The patient has been freed.
That's right.
So we'll resume. I looked at you like, what's going on here?
Yeah.
Okay, so I was asking you about your first surgery, and I understand you scrub in and attend a lot of them before you're the guy,
right,
playing the solos.
The first time that I was in the operating room, that's probably maybe a more formative experience for me, and that was up in Ogden.
Okay.
I scrubbed in with a doctor named Dr. Don Bryant, who was an orthopedic surgeon up at McCady Hospital in Ogden, and watched him do some total joints, watched him do some back surgery. He kind of did all around. He did everything orthopedics. And I thought, this is the coolest job on earth.
Yeah.
I want to do this.
At no point were you freaked out and you didn't think like, oh boy, this is tougher than or I'm in over my head, something like that?
No, I will tell you, it took me a little bit of time to get used to the blood.
Yeah.
You do a big surgery like a knee joint replacement. There's a lot of cutting. Mm-hmm. There's bleeding that takes place. And you had to kind of get used to that.
Right.
But the surgery itself was just so mechanical in terms of just taking something that needed to be change the alignment, fix things. I was in college at the Air Force Academy taking a break over the summer when I did that. So I was probably like 21, 22 at the time.
You just knew you'd found your place.
I did. I love the idea of doing that as a doctor, helping people get better. And so at that point, I decided to pursue, going to medical school. But prior to that, I thought that I would go to pilot training, which is one of the reasons I went to the Air Force Academy in the first place. But at that point, I decided, you know what? If I go to pilot training, maybe I won't do that for very long. Maybe I'll go back to medical school.
Right.
Then I ended up going straight to medical school instead.
You can't deny those moments when you just, it's like you hear a calling and you say, this is where I'm supposed to be.
It was just like that.
You can cut out plan A when plan B is suddenly like, oh, this is the new A.
And you look at that and you say, this is what I want to do.
Yeah.
For the long term, I like the kind of work that we're doing. I like the interaction with the patients.
Right.
This is of great value.
This mechanical bent, this interest in the way things function and the way they move, it doesn't just inform your life in medicine. It informs your life outside of medicine as well.
That's true. I'm kind of I like to tinker with things. I'm not, a great mechanic or a great carpenter or anything like that, but I like to take things apart, see how they work, fix them. As much as I can with my limited experience, or things I can look up on YouTube on how to fix around the house. I really enjoy doing that. I think one of the best gifts I got when I was young was an erector set. And, I just started building things, or I like those kinds of activities, and that really transitions well into my love of the anatomy, the working on the body. Yeah. Fixing things that are broken, as much as we're able to with our limited technology and resources.
It's amazing to me how you talk about just a little kid, and there are those now and then, if you're lucky, there are those seminal moments where a kid gets his hands on something. It might be a book, it might be an erector set, but it's like, the clouds part and the light shines down, and it's like, this is who this kid is.
Yeah. That's always been something that I enjoyed, but it's never really transitioned, like I said, into doing anything, any one thing except orthopedics.
Right.
Yeah,
but I can see it though, working with your hands and an interest in the way something's put together and the joints and the all. I'm sorry, go ahead.
No, it's cool work.
Yeah.
It really is. It's fun.
My favorite toy as a little kid was a little Fisher-Price microphone that would broadcast to the FM radio.
That's hot.
And so I
and look where you are now.
And it's just weird, right? It's not weird. I guess you can see it. I would play. I had a little cassette player. So there's the input selector. So you have to flip it down to cassette, and then you play a song, probably like from my parents' Michael Jackson tapes or something. And then when that song is over, you flip it up to FM quickly. And there you are. You just hold in on this button, and then you do the host segment, and you say, and we're back. That was Michael Jackson. And then, of course, if you're good, you have the other cassettes all queued up. So then you quietly pull that out, put the other one up, and you can broadcast. It's very short because the FCC would swoop in on you for pirate radio or something.
Right.
But you can broadcast to the other side of the house.
That's
so you
awesome.
Can do these shows for your parents in the other room.
That's great practice. A great way to get your feet wet into broadcasting for you, I suppose.
It's like, it becomes this lifelong interest, and I guess for me it was a little microphone. For you it was an erector set.
That's fun.
Here we are talking about these things. It's kind of cool.
Yeah, exactly. However many years later, we're still doing the things that we love.
I like that.
Yeah, I do too.
Time for a quick break on Focus on Your Health. We'll return with the rest of my conversation with Dr. Jacob Oldham in just a moment. This is the KJazz Radio Network.
I said you wanna be starting something. You got to be starting something. I said you wanna be starting something. You got to be starting something.
Welcome back to Focus on Your Health, here on the KJazz Radio Network. This week I'm speaking with Dr. Jacob Oldham. He's an orthopedic surgeon at Kingman Orthopedics. Before we started the show, we were talking a little bit about our wonderful desert world, and I really like to go out on my mountain bike from time to time. And we talked about that a little bit. Are you a mountain biker?
No, I haven't really done much mountain biking. I've done a little bit of road biking.
A little bit. Come on now.
Yeah. At times I do more road biking than other times.
Okay. So it's time to fess up. Your background in sports is?
Well, my earliest background, of course, growing up I did all kinds of things, but mostly I was a wrestler in high school. I boxed in college. And then once I was into kind of my medical training, I started really doing the individual sports, mostly running. I've done several marathons.
How many?
5.
Not bad.
5. My best time, it's not near Boston qualifying time.
Neither is mine. But I don't care.
It's fun.
It's about your own story.
That's exactly right.
You run your own race.
That's exactly right.
Yeah.
And then I had some friends that were doing some triathlons. In fact, my wife kind of started doing triathlons, and
you decided that marathons weren't tough enough, so you wanted to up the ante.
It's not that marathons aren't tough enough. It was more an issue that I enjoyed the variety of doing some other things in my training. In fact, my father, growing up, he was always a runner, and then when he was into his 60s, he started doing triathlons.
Oh my gosh.
And so he was kind of the first to do that, and then my wife and my children actually did a triathlon before I did, while I was deployed on my first overseas trip. And I came back and I thought, you know what, that looks like a lot of fun. And so I started training for triathlons, and I've done quite a few over the years. Last year I did an Ironman.
Graduated to a full Ironman.
Yeah, I figured that was kind of the next pinnacle I had to get over.
So just in case a listener is not familiar with a full Ironman, it is?
Okay, so it starts off with a 2.4 mile swim. And then you do the bike component, which is 112 miles. Right. And then it's a full marathon on the run, which is 26.2 miles. The marathon is 26.2 or is it 26.1? I don't even know.
26.22.
That's what I thought. Yeah, okay.
Oh. Now you just become snobbish about it. Like, I don't know. I've got all these other miles to cover.
Well, no. 26 is close enough.
Well, I can say I've run a few marathons, and it takes all I have to finish those. So I can't imagine, doing 2 other comparable events and then going out, because, of course, the marathon is the final event.
Right. You just kind of, just as when you first started running marathons, that seemed like, an insurmountable goal, perhaps.
The mountain, yeah.
Exactly. You just kind of train up, and as you get accustomed to doing more and more, it's amazing the body's ability to adapt to its environment. And how if you really want to do something and you're able to put the time and the effort into it, your body can do amazing things.
All right, so we're headed down the right road here. Dr. Cornelson also likes to run, and he and I were chatting about that. It seems like running comes up a lot on this show.
Well, that's cool.
Yeah, I like it. So I want to know, given what you know about the human body, this is a question I posed to him.
Sure.
How does that inform the training, the running, the long distance, the biking and swimming?
So first off, I think that there's an impression. A lot of people out there think that if you're training or running hard or doing some of these physical activities, that you're going to wear your body out. I think that's not true. I think there are certainly certain activities that if you do in the wrong manner or in an unsafe condition, you have the risk of injuring yourself, and there's definitely that. But for the most part, the cartilage of the body and the muscles and the tendons, they adapt to the environment, and your body is able to do amazing things. I mean, a lot more things than we really think we can handle. It ends up, if we just really keep going, we're able to manage those things. I mean, you look at people that are in survival situations, and you say, how could their body possibly endure those things? Sure. But they do, and it's the same as we're in a training situation. And so I'm a great believer that if you're not using it, then you may lose it. And so that doesn't mean to use it in a manner that's unsafe. You want to be smart about it, but I think your best chance of staying fit and active is to do the things that help you stay fit and active.
That
exactly.
makes sense.
You know, eating right, staying as active as you can be at your given level of physical condition. And I think the more you do that, the more your world expands, your horizons. When you feel like you can't do things, then you're putting yourself in a box.
Right.
And if you're continually pushing against those edges, pushing your boundaries, then you can look out at other things and say, you know what, I can handle that. Yeah. I can move on. I'm a great believer in the habit of doing hard things.
That's really inspiring, and I like it. When you finish doing a surgery, how does it work? You check up on somebody after the surgery.
Sure.
And the person comes in.
Either see them in follow-up or
Sure.
if I check up on them in the hospital.
Right. Do you find you are giving a lot of tips on nutrition and rehabilitation, or is that more physical therapy kind of people who do that stuff?
The physical therapists really do direct the rehabilitation.
Right.
But I try as much as possible to educate patients. I've tried to kind of take that to heart, that my real role is helping people understand what's going on in their body and how we can make it better. Yeah. When I say we, I don't mean me. I mean me and the patient together, along with the physical therapist or anybody else.
Probably the family at home.
The nurses, the family. I mean, it's a team effort, and what a patient gets out of their rehabilitation is directly proportional to what they're willing to put into it. Yeah. And the therapist, one of the things I tell my patients when they go to see the therapist, they need to view the therapist like a piano teacher. The piano teacher is there to give you direction, to say, here's what I want you to do. And then you have to go do it. You have to practice on a daily basis. I mean, you're a drummer.
I am.
If you had a drum teacher and they tell you, this is what I want you to do, but you don't do it on your own. You only do it when you're with the teacher. Right. It doesn't really progress your skill.
What all sorts of surgeries do you do?
So I love to do sports injuries. I take care of injuries to the shoulder, to the elbow, wrist, hands, lower extremities. The knee is a common spot of sports injuries. Right. Also take care of ankles and hips as well in the sports arena. But then we take care of, I say we, I and also Dr. Cornelson, Dr. Allen, we take care of arthritis patients, so we do joint replacements, predominantly of the hip and knee, but sometimes of the shoulder as well. We take care of fracture management, trauma cases. We were talking about trauma before. Yeah. So, people get injured on the freeway, or they fall off their quad and, break an arm. We take care of those kinds of patients as well. And we do all kinds of different surgery. We're just general and orthopedic shop. I don't take care of spine surgery. Okay. There are certain cases that you really need to go see a specialist for, complicated hand injuries and sometimes, some complicated injuries, especially to the foot and ankle, I don't tend to deal with very often.
When you look at your schedule and you see your procedure for the next day, what's a good day when you see, oh, that's what I get to do tomorrow? I love doing those.
I love taking care of, shoulder injuries. I love to scope the shoulder. I love to scope the knee. I love to do knee and hip joint replacement. I mean, those are kind of the more common cases that I do, and I love them. But I love pretty much every case that I do.
That's Dr. Jacob Oldham, orthopedic surgeon at Kingman Orthopedics. You can reach his office at 928-681-8693. That's 681-8693. Dr. Oldham, thanks so much.
Thank you so much, TG. I had a great time talking to you.
And that's the show. I'm TG LaFredo. Thank you for listening. Please join me again next Saturday at 11:30 a.m. for another edition of Focus on Your Health, right here on the KJazz Radio Network.
Perfect.
That's fantastic.